Well, thank you for coming out on a windy night in Johnsonville, which is probably every night in Johnsonville, but it's good to see you. I'm here to talk about ageing. So for those who may not know me, my name is Greg Brown. I'm the Medical Director of Wellington Hyperbarics, and I'll explain a little bit later what that is. But first of all, I guess, who am I? It's a good question to ask when you're talking about dementia. It's good to know who you are. I have a Bachelor of Medicine and Bachelor of Surgery with honours and final distinction from the University of Sheffield in the UK. I graduated in 2005, and I've worked in Britain and New Zealand ever since. In New Zealand regulatory terms, I am a vocationally registered GP, meaning I am on the register as a specialist generalist, if you like. And for a large chunk of my time in New Zealand, I served as a medical officer in the New Zealand Defence Force. Some of the time as a civilian, some of the time in uniform in the Royal New Zealand Navy. And I held a number of roles, including senior roles in operational health and clinical governance. So I got to do some pretty fun stuff during my time going to sea, and I also got to be the doctor to some semi-interesting people that you see on the right there. We're talking about ageing. It's an inevitability, right? Death and taxes. But before then, we have the ageing process. And we're asking really the question, I suppose, well, what does normal ageing look like? What can we do to arrest some of that process, and can it actually be reversed? So that's aging, anti-aging, and reverse aging. So is this final step here, that progression from fully functioning to some degree of, to coin a phrase, decrepitude, okay, or can it be reversed? And if the ladies in the room are feeling slightly left out by that slide, that's your version here. There's only 4 steps because apparently you make less of a meal out of it than we do. Okay, so we know, don't we, that certainly in all of the Western nations, birth rates are going down. The elderly population is increasing. The average age is increasing every year, which is okay. But we're also seeing growing rates of diseases of age, of degenerative disease. If you take dementia as an example, this is essentially almost doubling every 15 to 20 years. Now, those are raw figures. Yeah, as the population ages, of course, there's going to be more people in that sort of bracket, but it does show the scale of the issue. And when we're talking about the aging process, and we're talking about the role, I guess, of modern medicine in this process, and of lifestyle and other things, this quite nicely shows the kind of normal trajectory, that purple line in the middle, right, where you're well for most of your life, and then at some point you drop below that dotted line and you end up in some sort of dependence, okay, whether that's needing long-term care or lesser degrees of that, and then eventually you die. I would contend that much of what medicine does is to push that out a little bit, so that's that kind of orangey pinky line to the right there, which also often has the effect of really extending that period of dependence. And when you think about it in terms of what you would want for yourself, how you would want to live and die, you'd probably want that further dotted line to the right, which keeps you independent for as long as possible and has a minimal period of dependence before you die. So when we're talking about anti-aging and reverse aging, we're not talking immortality. That's a completely different talk, right? But we are seeking to make life as functional as possible for as long as possible. And aging at the cellular level is complex. It's relatively poorly understood, and there are lots and lots of factors that go into it. Now, I put this slide up not just to put big words up to prove that I understand them, but to show, actually, hopefully at the end of all of this, how what we're doing with hyperbarics affects a number of these things. So the 3 columns are pretty much sequential. You have the damage that occurs, you then have the response that the body generates to that damage, and then those collective elements get integrated into these couple of things on the end, stem cell exhaustion and communication things. And that lands up with the phenotype, with what you see with the aging process. Okay? So whether that's genomic instability, so instability of the genome, damage to DNA, and that's environments, things like ionizing radiation, the food that we eat, lots of things have the potential to do that. We'll talk a bit more about telomeres in a minute. Epigenetics is also interesting. This is the idea that you can actually switch on and off genes. That the genetic code is not as final and as deterministic as we were presented, say, 20 years ago or so. Because genes can be up and down regulated, in a very real sense, you can influence what happens as a consequence of your DNA without actually changing your DNA itself. And then other factors, proteins misfolding, nutrients, really important in metabolic syndrome and various other things. Now, when we get to we get to cellular senescence and stem cells, but as cells divide and divide and divide as they age, you get to the point where they don't divide anymore, okay? And unfortunately, they should be basically dealt with by the body and got rid of, but you can end up with a large amount of senescent cells that are sitting there, sending out inflammatory signals and really not doing very much except causing destruction, okay? And the net result is that you can't make the stem cells to repair and you age. Telomeres are the main clock, if you like, when you're looking at cells that show how old they are. Okay. These are sequences on the end of your DNA. So you see there on the left-hand side, you've got your chromosome, and then you've got the caps on the end of that chromosome. So that's a sequence that's designed literally to hold it all together. And what you will see after multiple cell divisions, and that's the first three diagrams on the right there, is that they progressively shorten. Ignore the bottom one, that's something different. But a senescent cell has got incredibly short telomeres. This is a cell that is really fundamentally not that useful anymore. On the right is an example of stem cells. These are cells that can become any sort of cell they like within reason. Okay, you've got hematopoietic stem cells, which come from the bone marrow and make all of your various blood cells. You've got mesenchymal stem cells, other things. Okay, so stem cells are really the body's supercharged method of repair, okay? And the relevance of that will become pretty obvious. When you age, lots of things happen that you barely appreciate, okay? So I'm just going to put up this time lapse here where some researchers scanned people's brains, volunteers' brains, for a period of 16 weeks, and what they showed was that they were having small strokes through this period. No symptoms, just stroke popping up, stroke popping up. Now, I, like many others, as a junior doctor, I did a stroke job where we were looking at lots of MRI scans of people that had had strokes. You always get this one-liner in the report about how you've got periventricular white matter. Okay, what that the ventricles are the fluid-filled bits in the middle. The periventricular area is the bit immediately around that, and it looks white on an MRI scan. And this was just sort of accepted that this is what old people's brains look like. Well, this study and this imaging very, very highly suggests that what that white matter is, in fact, is a conglomeration of infarcts, of strokes, of dead or dying brain tissue. Okay? And bearing in mind that none of these people had any symptoms, so this is happening all of the time. But it's okay, right? Because modern medicine's got this. Lots of clever people stand there like Minority Report, manipulating things on screens and coming up with fantastic ways to extend life and cure disease and generally, help mankind. I have to say, as somebody who's been in medicine for over 20 years now, I don't think that's particularly accurate portrayal. But I think if you ask people what they think science and medicine does, they will assume it's all of this clever stuff and advances are being made. We have a medical paradigm that, as far as life extension and healthy aging goes, really comes down to the micromanagement of risk factors and things to mitigate lifestyle choices that people have made that are not particularly helpful to them. Okay. And I'll try and demonstrate what I mean. Anybody who's on a chronic medication like blood pressure tablets, statins, aspirin, these sorts of things, would do very well to become familiar with the website, the nnt.com. Now, NNT it's a technical statistical term in medicine that refers to the number needed to treat. How many people do you need to give an intervention to get one good result or to prevent the bad outcome that you're trying to prevent? And that website is a group of independent researchers that are really just trying to boil down the evidence into something that's meaningful. And when you pull the evidence together and you boil it down like they do, you get some pretty interesting conclusions. And I've had some fascinating conversations with patients on this stuff because they've often never heard it before. Loads and loads of people take an aspirin to prevent a first heart attack or stroke. Okay? That aspirin is not going to save your life, right? Nobody is going to not die because of taking that aspirin, okay? Very small numbers might avoid a non-fatal event. And really, in gross terms, almost as many will have a major bleeding event that lands them up in hospital, requiring admission and transfusion, okay? Something a lot of people take, thinking it's doing some good, it's probably net doing harm. Statins, my favourite subject. These are really, really, really terrible drugs unless you are a middle-aged man who's already had a heart attack, okay? Taking a statin for primary prevention to extend your life, it might extend your life by about 18 days. That's what the research says in aggregate, okay? However, it's far more likely to give you diabetes, 1 in 50 chance, than it is to prevent a heart attack, 1 in 104. So in a very real sense, most drugs don't work for most people. Those 104 people that I give a statin to, 103 of them are not going to benefit. Now, we don't know who that one is going to be, and that's why things are done the way they're done, because people are looking on a population level. But if you boil that down to the individual patient, can I, hand on heart, say that this intervention is going to do anything apart from probably give you muscle pain and damage, 1 in 10, and may give you diabetes, a serious long-term condition that significantly elevates your risk of heart disease. It's pretty dumb, right? But we're doing it. Blood pressure medications, that's got to be better, right? So yes, it is. It's a little bit better. What we normally tell patients is, your blood pressure's raised. If we don't get this down, you're going to have a heart attack. I don't think that's true, because 99 out of 100 that we give these to are not going to benefit either. Okay? 66 out of 67 won't avoid a stroke. Okay? There are fewer harms in this group, which is why this is more, I guess, permissible in terms of those risks as they stack up next to each other. But it's not the wonder drug, is it? It's not the life-saving thing that you think it's going to be. So all of this micromanagement of risk factors actually does very little for the vast majority of the people that take these drugs. Gets a bit worse. So if we just go back, skipping over my slides here. This paper was published the year that I graduated, and I have to say it's been quite a big influence on my career. Because it's made me much more circumspect in the way that I prescribe. And I think the longer I go on, the less I actually prescribe, or the harder I try not to prescribe. John Ioannidis is quite a well-known figure now, because he took some different stances on COVID and called it quite early in 2020 as to what things were going to look like. Took a bit of flack for it, but he's a professor of epidemiology at Stanford University. He is the most cited medical scientist in the world. He's got a strike rate of putting out papers that's just quite incredible. I've no idea how he does it. This paper showed that through a combination of publication bias, shoddy research techniques, industry bias, most published research is probably false. And at least 80% of it is non-replicatable. So nobody has ever replicated the findings. You've got one single paper. Now, back in the days before all clinical trials had to be registered, you could run 20 trials, pick the one that showed the benefit, and bin the 19 that didn't, and that was completely acceptable. And that is much of what underpins medical science and the practice of medicine today. And if you don't believe me, there's been 2 major examples of this just in the last fortnight. I don't know if anybody's been tracking the press over the neurotransmitter, the chemical imbalance theory of depression. But there's been a lot of mainstream newspaper articles on this stuff, really just showing that that it's patently untrue. There never was a neurotransmitter deficiency in people with depression. The fact that that's the way the drugs work doesn't actually imply that the theory was true. It's highly likely that much with the reason statins work for some patients is that they block the action of platelets like aspirin. It's nothing to do with cholesterol. The reason that antidepressants work is probably due to some of them being anti-inflammatory and crossing the blood-brain barrier. But we don't know because we've been down this rabbit hole of brain chemistry for the last 30, 40 years. And speaking of rabbit holes that were created by going off on an untrue tangent, the other massive one, again, just in the last 2 weeks, has been the theories around what causes Alzheimer's disease. So for years we've been told that this is due to an accumulation of certain proteins in the brain, amyloid plaques and all that sort of stuff. Well, it turns out that the key trials that supposedly showed that were most likely deliberately and blatantly fraudulent. I mean, we're talking like photoshopping things together to show things that the trials never actually proved. And the whole of that area of inquiry, including the drugs that have been developed to try and target Alzheimer's, has been predicated on the assumption that it's amyloid plaques that's the problem. It's probably not the problem. It's probably more due to disorders of blood flow, which is good for us at Wellington Hyperbarics, and I'll explain that in a bit in a while. We've then got an unproven drug called aducanumab that was licensed by the FDA this year on the basis of 0 evidence that it actually improved Alzheimer's. They licensed it because they'd shown that it can reduce the appearances of amyloid plaques. Well, if amyloid's not the problem, if that's a symptom, not the cause, that drug is literally going to do nothing, and indeed it does nothing, but they licensed it anyway. I mean, how can that possibly happen? That's how broken it is. Okay? So that's the state of medicine, okay, which is relatively depressing. So how can we mitigate the effects of aging? How can we try and break that link? Okay? In terms of anti-aging, the solutions are relatively simple, right? So how do you stop the aging process from occurring quite as quickly? Okay. The 3 main problems: metabolic syndrome, heart disease, sarcopenia. We'll go through them. Okay. Metabolic syndrome, this constellation of manifestations, including increased belly fat, and then some of these changes in the blood around triglycerides, blood pressure, high blood sugar, those sorts of things. Okay. And that's the thing that tends to lead to diabetes, dyslipidemias, those sorts of things that we treat with drugs. Heart disease, pretty self-explanatory. I'll just explain sarcopenia. So what we're seeing on the bottom right there is a couple of scans. One of healthy muscle. So that's all of this light grey stuff is muscle, and then you see here there's lots more black. There's much less muscle there. That's the appearances in an elderly person who's lost muscle. That is a huge independent risk factor. It's a predictor of whether somebody's going to do well in things like orthopedic surgery, but it's also a good predictor of longevity. Okay. Metabolic syndrome is 100% fixable with diet. Remember, I used to work in military practice. I gave a bunch of people with metabolic syndrome a plan, and if you give a military man a plan, they generally do it, especially if you tell them that it's going to mean that they can be thrown into the back end of Afghanistan again, which for some reason they really love. So if you give people real food, plants and animals, meat, fish, eggs, fruit, vegetables, nuts and seeds, and you avoid processed food, you will cure metabolic syndrome, which is fundamentally anti-aging. Heart disease, all you need to do is walk for 20 minutes a day. You don't need to be one of these freaking miserable looking people sort of, shuffling around Wellington waterfront, southerly optional, but either way they look absolutely miserable, right? You just need to go for a walk. Sarcopenia is fixed by resistance exercise. Ideally weight training, but simple stuff like body weight training will also work. None of that has anything to do with the medical profession, and actually, we get that wrong as well, and we advise people the wrong diets, and it's all a bit of a disaster. I could talk about the food pyramid for another 20 minutes, but I won't. What we're interested in Hyperbarics is that next stage. Can you reverse age somebody? What is hyperbaric medicine? Well, what we do is we deliver high flow oxygen at higher than atmospheric pressure in hard shell chambers, and these are our chambers that we have at the moment up in Plymouth. And this is different to really anything that you might have seen advertised as hyperbarics in New Zealand. This really has not existed before we did. So I'll show you what it looks like. So this is just a little walk inside the chamber that I took yesterday. So it's all very pleasant. Doesn't look like a submarine. Doesn't look too industrial. The seats are comfortable. The acoustics are nice. It's nice and quiet in there. You sit in there breathing high flow oxygen on a cycle, on and off, for about an hour and a half. And this does three main things. Firstly, angiogenesis, new blood vessel formation. Okay? So where you've got poor perfusion of blood into a tissue, Hyperbarics not only dissolves a whole heap of oxygen into the blood plasma that can access that tissue, it also promotes a growth factor that causes the body to make new blood vessels. So this can bypass blockages, this can reperfuse tissue that has had a lack of oxygen, sometimes for years or even decades. Hyperbarics also stimulates stem cells to be produced, and it does this through the cycling on and off of oxygen and essentially tricking the body into thinking it's in a low oxygen state, releasing stem cells to repair the damage. So you can really 8x the number of stem cells that are circulating through hyperbaric treatment. Then you've got reduction of inflammation. That's primarily done by this epigenetics that I was talking about before, switching on and off genes. So it turns on anti-inflammatory genes and it turns off pro-inflammatory genes. How does this look in practice? I'm going to introduce you to somebody called Professor Shai Efrati, who is a neurologist in Israel, Tel Aviv, Israel. And he's going to, just in these couple of brief clips, we're just going to show some brain scans and show what happens when you do hyperbaric oxygen. So let's listen to Shai.
And what we see in the age-expected cognitive decline, we see the white patches in the brain of the MRI. And this mark ischemic lesion in the brain, areas that are malperfused, small tissue. And this patient is fully healthy. She didn't have stroke, she didn't have myocardial infarction, no diabetes, nothing. Only the expected cognitive decline. And again, we are in the wound business. We see it's appropriate wound. We are treating the wound. And you can see in the middle before and after. And you can see the significant increase in perfusion. No discussion. This is your brain before, this is your brain after. We can measure the delta.
So that links back to what we were saying before about the white matter in the brain that's caused by these micro strokes. And he's showing there quite clearly in those very specialized scans that you can significantly improve blood flow to the entire brain. What if that brain is already damaged? I'm going to just see the scans now of a stroke patient.
And in blue, we mark the area that is necrotic, that is completely dead. Green is the metabolic dysfunction, and red is the fully functioned tissue. And you can see quite clearly that the blue stay blue. Whatever is necrotic stay necrotic. But the green, the metabolic dysfunction tissue, can be rejuvenated and regenerated. This is another example, another classical example. This is a stroke patient that cannot move the hand and the leg. And you can see in the upper row on left, you can see the metabolic dysfunction tissue that is responsible for the hand and the leg. The green become yellow, and it means that the hand and the legs are moving again. On the second row, you can see the Broca marked in green. She cannot speak. And after the treatment, she can speak. It's not that we were treating her speaking capabilities. We are only treating wounds. And whatever this wound is responsible to, that will happen. Our business is wound care. It doesn't matter when the wound is. We can see additional different example, and today we are using perfusion MRI and DTI, and this is another example. You can see the classical MRI, anatomical MRI on the left. You can see the perfusion from the MRI combined with the anatomical imaging, and you can see the before and after, and you can see how the cognitive function were significantly improved.
Okay, so we're in the wound care business. It doesn't matter where that wound is. And what they've shown quite clearly at their Centre of Excellence of Research is that they can dramatically improve outcomes in people with very significant injury from stroke. And they're now extending that into age-related cognitive decline and getting very similar results, because as we suspect, Alzheimer's disease, as one example, is probably more to do with decrease in blood flow than it is anything to do with misfolded proteins. And really just the range of conditions that Hyperbarics is capable of treating is extending all the time. So we see here, we've got things as disparate as long COVID, Alzheimer's, traumatic brain injury, dementia, those sorts of things. And if we go back to our mechanisms of aging at the cellular level, hopefully you appreciate that because Hyperbarics works on the cause, it works on the pathology at the cellular level, whether it be shortening telomeres, which we now know are lengthened by Hyperbarics, whether it's turning on and off genes, it's the epigenetics, things like clearing out senescent cells, but particularly stem cells. Okay. What Hyperbarics really does is it sort of presses the on switch for the body's own healing processes. So we're not telling the stem cells where to go. We're saying there's a wound, go heal it. Okay. And I think the results really do speak for themselves. There's a few disadvantages of Hyperbarics. There are some people who shouldn't be going in the chamber, and it's my job to make sure that doesn't happen. It is expensive, both monetarily, but I think particularly also in terms of time. We're talking about north of an hour and a half, 5 days a week for several weeks, and that's very difficult for many. And I think within my profession, what we're dealing with is really a lack of knowledge of what this therapy can do, a lack of acceptance as to its value. And unfortunately, doctors specialize in disagreeing with each other, and we tend to belittle what we don't understand. So, returning to this inevitable process of aging, Modern medicine doesn't have many answers. It's got a few mitigations. They're not very effective. Lifestyle choices, good lifestyle choices around diet and exercise can certainly have anti-aging effects. But if we're really seeking to sever that link between fully functional and the dysfunction that we so often see at the end of life, suggest to you that Hyperbarics is by far the best tool that we have for that. And it does that from the cellular level upwards. And if that's something that's of interest, there's our website. Thank you for your attention. Happy to take questions.